Hello and welcome to another Unscripted Surgical with your host, Dr. Richard Farnam. Thanks for joining us. As you can see, I am here in lovely El Paso, Texas, practicing social distancing, which brings us to our topic for today's conversation, which is COVID-19 or the coronavirus. So there's a lot of information out there, and I spent most of the weekend looking at medical websites, the CDC website, the WHO website, publications that have come out to try to separate some of the fact and fiction. So I'm going to present to you what I've come up with. I'm in no way an expert in this area, but just as kind of a nerd that wants to inform himself, I've educated myself a little bit, talked to some experts. What is this coronavirus? So the virus itself is actually named SARS-CoV-2. So this is an enveloped RNA virus. It's made up of 39 different virus types and many other virus subtypes, such as common cold. This specific virus, the COVID-19, which is the disease state that's caused by the SARS-CoV-2, it's the third virus that's been transmitted from animal to human in the last 20 years. You're familiar with the 2003 SARS outbreak and then the MERS outbreak that followed that. All right, so now we'll switch gears a little bit. We're going to have our local colleague, Dr. Randy Goldstein, come, and he's an ER physician. He's going to tell us about his perspective of the COVID-19 virus. So welcome. As promised, we have Dr. Randy Goldstein. He is the Chief of Staff at Trans Mountain Hospital here in El Paso, Texas, and also ER physician. So he's here to help us answer some questions. So, why are we wearing masks?
I can't breathe.
This is crazy.
Much better.
So I would ask, do people need to walk around wearing masks?
No, for the most part, people do not need to walk around wearing masks. First of all, masks, at least the kind of mask you were wearing, a standard surgical mask, doesn't really protect somebody from catching a virus. It does do some protection in terms of if somebody is infected, transmitting the virus. So we do sometimes put masks on patients in the hospital before we know what their ultimate situation is.
Makes sense. So, I mean, this is really just for surgical procedures or office procedures to prevent bodily fluids. This is not designed to protect from small particles. This one is the N95, which basically just means it prevents 95% of small particles. Hospital staff will wear this, and there might be some circumstances.
Yeah, so we really limit this to if we feel, and this is for the healthcare provider,
exactly.
If we feel that we're potentially going to be exposed to somebody with a virus, coronavirus. So even this is being used in very limited fashion.
And really, I mean, there's a process to put it on, make sure there's no leaks. So really only healthcare providers don't run out and buy a bunch of masks. Don't buy toilet paper either, right?
You don't need toilet paper.
We don't.
It's not a GI virus.
I'm not sure why that's from. So this is this is not a natural disaster. The water in your faucet is going to work. You don't need to stock up on bottled water.
Tastes just as good as it did yesterday.
The electrical grid, that's not down. That's going to work. So there is a lot of hoarding, a lot of panic going on, and so we just wanted to have a common sense conversation about what this means without getting into prognostication or anything like that, and what the average person would do. So, Randy, as a emergency room physician, what kind of patients need to come in to be seen?
Okay, so that's a huge question. Because our sense as patients is that I'm sick, I need to go to the doctor. And well, if that's at nighttime or a weekend or my doctor's office doesn't have appointments, well, I'm going to go to the ER. And really at the end of the day, that's the worst thing you can do right now. Coronavirus is a virus. The reality is there's not a treatment for the virus. So coming to the hospital because you're looking for a potential cure is not really an option. Ultimately, who do we need to see in the hospital? We need to see people who have severe illness. So who is that? Patients who are having significant respiratory problems, patients that are so sick that they're not eating, they're getting dehydrated, they're having altered level of, mentation, things of that sort. But that's a very small population of people. For the most part, those that might catch this virus, like any other virus, are going to have mild symptoms, fever. This is a respiratory virus, so runny nose, cough, a little bit of, trouble breathing. Those folks don't need to rush to the hospital. And to be even clearer, those folks should not rush to the hospital because that puts other folks at risk.
Well, let's talk about the statistics. So for patients that are going to get exposed to the coronavirus, 80% of them, this is a self-limiting flu-type virus that they're going to be able to recover from at home. 20% around that will not get better. They'll have high fever, maybe some difficulty breathing. Those are the people that would need to come in?
Well, and even if that's 20%, only a small percentage of those folks are going to get very sick. So even if you're the 20% that has high fever, that has maybe a little bit of trouble breathing, the treatment is still what we call supportive care, which is take care of yourself. It means if you have fever, take Tylenol and ibuprofen. If you're just not feeling well, stock up on fluids, Gatorade, chicken soup, the things grandma might tell you to do. But again, there's no magic pill, there's no magic shot that's going to make this go away. The folks that are critically ill, they may require a totally different level of care, being in the intensive care unit, being on a ventilator to help their breathing, being on IV fluids because they're just unable to do it themselves. But that's the very small population of folks that need to be hospitalized.
So that fraction, and I don't know the number, but let's say there's 500 ICU beds in the city. There's 501 patients that get coronavirus, somebody doesn't get a bed. So we have this concept of flattening the curve. We've seen it, social media posts, and essentially what that refers to is enacting these preventive measures so not everybody gets sick at the same time. Is that more or less what we're talking about?
Right now we're on this exponential incline, meaning every day the number of people being tested positive is more than the day before. So the curve looks like that. Part of that might be that more people are getting sick, but part of that might be simply that we're just testing more people today than we did a week ago. So we want that curve to flatten out and eventually turn downward and eventually go to zero. So how do we accomplish that? We accomplish that by limiting our interaction with people who might be infected, this social distancing, which, this is what we're doing in our schools, our sport arenas, our concerts, limiting large gatherings, more than 250 people, although I heard now they've changed it to 50 people. These are the things we're putting in place to prevent transmission so that we could flatten that curve and eventually get to a decline and eventually get to zero, which we will get there.
Very good. And so who is at risk? I mean, most of the patients, this is going to be an illness, typical illness, they'll get sick, they'll get better. For children under 9, there have been 0 fatalities. For patients under 60, very, very few fatalities. So it's really the over 60 and who else might be at risk?
It's the over 60 and the folks with either an immune system problem. You might be a cancer patient getting chemotherapy. You may have had a bone marrow transplant. You may have had a heart transplant. You're on immunosuppressive drugs. You may have lupus, rheumatoid arthritis, and you're taking medications that suppress your immune system. Those folks, that's a different ballgame. And then people with respiratory disease in their underlying, situation, emphysema is the main one. If you have COPD emphysema, you're a bad asthmatic, where you might not fight a simple respiratory virus like the rest of us. Those are the folks that are getting sick. I'm gathering those are the folks that are leading to the fatalities.
Very good. So one other question, people are worried and all of this panic that goes on pretty much in every, large viral threat is this concept of hoarding. But really only a very, very small fraction of patients will actually need to be quarantined, right? So what does that process look like? Who might be candidate for quarantine? Or let's say they come in, they are ill, they're not getting better, they get tested for other causes of viral illness, and then they have risk factors that cause them to get tested for this COVID-19. What happens next?
If you have fever and respiratory symptoms, you might have COVID. You might have rhinovirus. You might have influenza virus. You might have RSV. You can have a whole host of things, but for now, the population at large is not immune to COVID, so it's a greater risk. That's the reason for quarantine. That's the reason we're shutting down schools. That's the reason we're just telling people, if you're sick, stay away from other people. If you're not sick, live your life.
All right. Well, this is the information that's there. Like I said, we put this together to try to tease out some of the fact from the conjecture. It just comes down to no cure, good hygiene, social distancing. We're all going to band together and get through this. So
history will show we're going to get through this.
That's it.
We just don't know whether this is going to be days, weeks, or months, but we will get through this.
All right. Well, I really appreciate you coming, spending the time, and helping and educate everybody out there. And if you have any questions, you can put that in the comments section. And thanks again for tuning in.
Stay safe.